Thank you all for joining us today. We are excited to bring you this webinar on how to be a leader in times of crisis, practicing fear-free during the COVID-19 pandemic. My name is Stephanie Bachman, and I'm the Customer Experience Manager for Fear-Free. Fear-Free is producing a series of webinars surrounding the coronavirus pandemic, so make sure you check out fearfreepets.com to find the COVID-19 resources page and look for upcoming webinars as well. All webinars will be recorded and live on this COVID-19 page for reference at a later time. I'm going to request that everyone type their questions in the Q&A section in the bottom bar of your screen in the Zoom webinar window. All questions will be answered or addressed at the conclusion of the webinar. I'm pleased to introduce our speaker today. Dr. Natalie Marks is a 2002 graduate of the University of Illinois College of Veterinary Medicine and has been practicing small animal veterinarian in both the Atlanta area for 5 years and for most of her career at Blum Animal Hospital in Chicago. The previous owner and medical director, Dr. Marks led her team to be the first fear-free certified hospital in Illinois and the 7th in the country. Besides practicing, Dr. Marks is a national educator and media presence, contributing not only to veterinary-based journals, podcasts, and conferences, but also being featured in consumer-based print, digital, radio, and television spots regarding veterinary medicine. When not practicing or consulting, she loves traveling, spending time with family and friends, pure bar classes, and binge watching Naked and Afraid survival shows. Dr. Marks, we are so looking forward to your guidance as we all acclimate to this new normal together.
Thank you so much, Stephanie. And I was just listening to you and thinking the traveling and spending time with family and Pure Bar, I can't even do right now. So I'm anxious to get back to whatever our new normal will be once we get through this together. So thanks to everybody who is on the webinar today. I want to stress first before we start that Monique Fairchild, one of my colleagues, did a webinar a week and a half ago going through some logistics about practicing fear-free, how to implement some workflow changes, how to do curbside pickup, so on and so forth. So I won't be repeating a lot of that, and I encourage all of you to view that excellent information. But we're going to talk today obviously a lot about fear-free, but more importantly, how do we lead our teams when there are challenges during this pandemic, and what is the best way for you to stay healthy so you can be a leader in a time of crisis? So just a refresher again, I always like to start with our mission. Our mission really for all of us on here is to alleviate fear, anxiety, and stress in pets and educate and inspire the people that care for them. I think we have more than enough fear, anxiety, and stress within ourselves right now. We can't forget that our pets are experiencing the same and maybe more for some of the reasons I'll go over. I really enjoy quotes, so I want to kind of frame these as we go through this. You know, the true test of leadership is how well you function in a crisis. And if there was ever a crisis in today's world, and certainly within veterinary medicine and navigating this pandemic, it's really now, right? Because we have so many hospital challenges that we're facing. Social distancing. If you've ever been to our hospital here in Chicago, we have 60+ team members shoulder to shoulder. And I have taken off my mask simply for this webinar, but we are masked and gloved and trying to socially distance and have broken apart into small teams, which I know a lot of practices are doing around the country to try and allow better social distancing within the practice. Work culture right now is a challenge, and we'll get into that more as we go, but not necessarily because of veterinary medicine itself, but because of everything, all the baggage we're bringing into the practice of what we're dealing with in our own lives. The financial implications for your business. You know, do you have enough business right now to keep everybody on staff? Are you going to need to lay off people? Do you need to furlough people, cut hours, split shifts, share jobs? There's a lot of question out there, and certainly a lot of support that will be able to help guide you if you have questions about this. Not only the physical health of our own human population, but the mental health of our teams is incredibly important to be surveying and watching and monitoring very closely right now. We know we have enough challenge within veterinary medicine as it is with mental health. And now we're adding the worry of this pandemic and all of the new normals we've had to implement in our practice. And it can be a huge taxing time on already vulnerable population. And as I mentioned, staffing and work hours, right? So our team has broken into smaller teams and we're working 12-hour shifts every other day. For some of us, that has been what we've been doing. For others, that's a huge change. And it can be very hard on teams to suddenly have to do something that they're not used to doing. You know, there's a lot of endurance in that. And it's also a challenge in taking care of your family when you're at work. So a lot of hospital challenges already, but then we add in the fear-free challenges because we are all, of course, believers in fear-free because we know it's the right thing to do. But we add in the challenges of COVID-19, and we can't forget that that's going to change a little bit about how we practice fear-free medicine. A lot of our patients do much better with their parent with them. And now, if all of you are doing very similar to what we're doing curbside check-ins, which means that those patients now are suddenly without their wubby, right? Their parent. And so that increases their fear, anxiety, and stress away sometimes from the parent. And it certainly can influence how we handle those patients and what we need to do ahead of time. PPE, whether you're wearing full PPE or masks and gloves, that's not something our patients are used to seeing all the time. So that can be a trigger for fear, anxiety, and stress. And patients' FAS may already be escalated from being home, right? So a lot of our pets are not getting the exercise that they're used to getting. They aren't going to training classes or agility or maybe some other outlets. Sometimes, of course, we know pets can have transfer from their parents' anxiety to them. And obviously, there are patients that we're going to be seeing that maybe had very low FAS scores beforehand. And now all of a sudden you're coming in and you're like, this isn't the same dog or cat because, of course, of this new situation. So we have to be really aware of that. Your workflow is going to be very different. And so for some patients who are used to a certain type of exam and a certain maybe journey through the hospital, that could be altered. And that might also trigger them. And then again, a lot of our clients are probably telling you that they may be noticing new behaviors in their pets at home. We have to be really aware of that and encourage them to be using different types of enrichment based on what their environment allows. And so if you're a creative person by nature, this is a time for you to shine because there isn't one perfect thing that works for every pet, and there isn't one perfect thing that's going to work for every household. So it's really important to be listening to our clients and understanding their specific concerns and then working with them to create that new protocol for enrichment at home. So I love this from Richard Branson. Communication is the most important skill any leader can possess. And I truly believe that no matter who you are leading. And right now, veterinarians are being called upon to lead their clients, to lead their teams, a lot of times to lead their community in regards to veterinary information, to lead their families, to lead their children. I don't know how many of you are struggling with homeschooling like I am. I have 3 children I'm trying to homeschool at the same time. You know, we have a lot of situations that we have to navigate and communicate. But this is why I cannot stress enough these 3 things that will help you be a better communicator even when you feel like your world is coming apart. We need to be transparent, we need to be open, and we need to be honest. And those are 3 traits every successful leader has. And I know sometimes it seems like, you know, why would we be transparent if sometimes that information isn't necessarily the best news? Well, here's the thing. We have to be the basically guiding light for our clients right now, especially with what just happened yesterday at the Bronx Zoo with positive tigers. There's been just an explosion of cat owners now on the web and contacting those of us who are in the media wondering, can I go to my veterinary office now? I don't want my cat getting sick. Am I going to get sick from my cat? And a lot of question there. We have a lot of resources we can provide to those clients, but we also have to remember that these clients are very, very nervous and anxious, and they're looking to us for guidance. So we need to empathize. We need to take a breath and remember that we may not know everything right now. And I have sent out emails today already explaining that to clients. We don't know everything. I will tell you what I know. I will tell you that I will be here to give you that information once I know it. But we're taking it a step at a time, and we're looking to experts to help guide us in that process. whether it's the AVMA, the World Health, the CDC, and other expert groups. We want to encourage our clients. They need to try and stay as calm as possible. It's not helping them. It's not helping their pets to get anxious. That we still stress the importance of emotional health of our pets to our clients, and we can help give them support for that, whether it's through PVPs or enrichment. And again, frequent communication with the clients are so important. We don't want to give out information today and then wait 3 weeks to give out more. So when those clients are calling and they are going to come in, do we have information already for them in our emotional medical record? And if we don't, if it's a new client, get that information ahead of time to really ease that appointment. It's so important now to be reinforcing travel expectations in the car and with the cat carrier, right? So if they have to come in, really stress to them the importance of pheromones and calming music and leaving the cat carrier out and all of the things that we stress for ease of travel. And never has there been more an important time of remembering PVPs. Even those patients that knew we didn't need them before, so important to be giving them at the right time and obviously at the right amount. It's very important to encourage that support, like I mentioned, even thunder shirts, but before they come and reach the actual practice, we want to encourage them to take off any clothing or other accessories so that we have limited amount of fomites even coming into our hospital. And then for your physical exams, they're not with our clients right now, right? So you want to make sure that you have your own protective gear on in the appointment. We're using masks and gloves for standard appointments. This is a great time to use licky mats and puzzle feeders and other types of cooperative veterinary care so that you're limiting the amount of people that need to be in that exam room with you at one time. Hopefully you're using some type of either FaceTime, Skype, Zoom, some type of telemedicine communication, even just a phone call at this point to discuss that physical exam with the client, go over recommendations, and really explain to them if you're seeing signs of fear, anxiety, and stress, and ask them if they're seeing that at home. Some clients that are new to you may not even realize what that means. And so that's a really important time as a touch point to educate clients on what we could be doing differently to relax those patients, whether they're in hospital or at home. Keep those exam rooms stocked with more maybe than you typically do, because the more you can contain everything in that exam room, the better, right? For social distancing, for travel throughout the hospital, and obviously more importantly, for that patient's fear, anxiety, and stress. So diagnostics that can be done in there, obviously outside of radiographs, really should be there. And then obviously that patient returned to the client. Again, quotes, this is from Rudy Giuliani. "It is in times of crisis that good leaders emerge." And this is the time really when I love to see people kind of come out of the woodwork and take charge, because some people, this is really when they thrive, is when they're really pushed and taxed the max. But for those people that are in a leadership position that are maybe feeling like this is just too much for me. And, you know, I want to stress to everybody on this call, I am in a leadership position in a lot of different aspects of my life. And right now I've had a lot of days where I feel like I'm kind of falling apart. This has not been easy. There are a lot of stresses going on, and there's more to come. And as we know, this is a marathon, not a sprint. So be easy on yourself. We are not perfect. And with the added task of trying to navigate a pandemic through all of this, we just have to take it a day at a time. So try to remember these really important traits that successful leaders really exhibit in times of crisis. Again, flexing and adapting, being creative. What we know today, we know will not be the same tomorrow. We know every day this pandemic is changing, there's new information, and veterinary medicine is sort of weaving its way into that. So you need to be able to adapt and flex with the times. Prioritize what is important. The number one importance right now is your team's safety and health. I cannot stress that enough. I'm a veterinarian. Obviously, I've dedicated my life to the health of pets, but right now our team's safety and health is most important. So make sure that is always the top priority in what you're doing at the hospital. It's great to build a short-term plan with your management team, you know, whether it's changing hours, breaking up into teams, how you handle curbside check-in, verbiage for the phone, your social media presence. Build a short-term plan and realize you don't have to stick to it if something changes. We can have this plan for 2 weeks and reassess. It's great to have a different group of people involved from different aspects of the hospital so they can give input on how things are working. And we do that a lot at our hospital. And educate yourself. I've listed some great resources. The CDC, the World Health Organization Daily Situation Report is really interesting and great information. AVMA is putting out daily briefs about this, and obviously their website is full of really effective information. But you need to stay educated, because if you're going to lead and give communication to your team, it has to be correct, right? So make sure you're staying educated. Leverage your team. This, more than anything, takes a village. I have a massive remote village helping me right now. And I'm not ashamed to say it. There is absolutely nothing weak about asking for help. And I really encourage everybody out there that if you are handling your practice by yourself or with very little help, and you're handling your home and you're handling senior parents who need help, you don't have to, and please reach out. It's too much for one person. So leverage your team. Be positive in a realistic way. It is not helpful to give false hope and flowers and sunshine and rainbow and pots of gold right now. If we know that what we're hearing from the Surgeon General, that the next 2 weeks are going to be really hard in the US. However, that doesn't mean we're negative Nancy every day. We have to be realistic and certainly can be positive about things that our team is doing well. So share success stories and be positive and continue to compliment your team for a job well done in what they're doing that day. These don't have to be major accolades. It's just in the moment. And be authentic. It's no good to hide bad news. Okay, if there are things that need to be discussed within your practice, a COVID positive employee, a client concern, something happening in the community, be calm, be authentic, and give them the information they need in a way that they can process it. It might be different the way you deliver that depending on the team. Create ways to stay connected, whether it's chat rooms or email lists or virtual happy hours, whatever your team is doing. Make sure that you create ways for them to stay connected and feel part of the team. And most importantly, manage yourself. Right now, the leaders of the nation, the leaders of our veterinary community, the leaders of your hospital, leaders of your home, if we fall apart, it's a domino effect. And so I encourage you as much as possible to manage yourself, know your limits, do not be afraid to ask for help. Make sure that if you are at a point where it is too much, take breaks, delegate, reach out to people, and certainly, again, it takes a village. This cannot be done alone. So within Fear Free in your hospital, to continue the momentum that we have tried to provide for this initiative, keep telling yourself fear-free medicine is the right thing to do, right? It's hard right now. Everything is hard right now. But fear-free creates that inherent endorphin release of reward when things are going well. So share success stories with your team. Share success stories with clients. Lead by example. Continue to do your considerate approach. Continue to do your treat rewards. Continue to do everything that you've done within your hospital to create a fear-free environment. But you might have to be creative again, because you don't have that third part of the team, that pet parent, with you for a lot of those patients. Like I said, acknowledge your team members, and remember, stop being critical of yourself. If what worked before in that emotional record, medical record for that patient for fear-free does not work now, this is not normal. This is not a normal time, and we need to be creative. But the beauty of fear-free is that we've been able to give everybody a foundational baseline of different tools in our toolbox that we can use. So maybe before you were using a PVP and a Thunder shirt, and that's not working right now. So maybe we need to come up with a different cocktail, a different type of approach, a different type of discussion at home for preparing for the hospital, and even maybe a different team. Maybe that patient needs more of a telemedicine approach. Be creative and don't judge yourself, because we're all doing the best we can. So within your team, offer support traditionally, but also offer support creatively. Some team members may need flexible work schedules. Do your best to offer that, because we want to keep our teams, right? If you have resources for childcare, in Chicago right now, there are resources for healthcare workers for childcare, because we know we're essential and not all of us have that ability. Provide that for your team. They need it. Resources for mental health. I'll do that on our next slide. If you can, continue to have one-on-ones with your team members. Every team member right now has a different worry, right? It might be financial. It might be physical health. It might be mental health. It might be worry about a family member. It might be social anxiety. There's a myriad of them, and everyone's a little bit different. And just having a one-on-one with a team member and being able to ask them, how are you really doing? And what can I do to help you better? Sometimes even just broaching that question, you will see a sigh of relief, because the team needs to know right now that they have support within their team in their hospital, but also from the veterinary medical community. We are all, as I read on Facebook, a beautiful quote, we're not the front line right now, but we're the rear line defense. We're providing ventilators. We're emergency medical support if state and country needs it. We're donating our PPE to human health. We're doing a lot of things to help create the human-animal bond, instill a very, very strong, if not even stronger force at home. We're doing a lot of things right now that people don't realize. And so let that team member know how valuable they are to us and that we are here to support them. Just ask. It's really important to ask. So I want to just make sure everybody's aware of 6 really helpful mental health resources that are out there right now. The AHA Culture Initiative, you can call and talk to AHA. They will provide a consultant to remotely go over a review of well-being issues and recommendations on how to improve practice culture if you're really struggling with the environment within your team. AVMA also has this workplace well-being module where you can do 5 modules, empowering veterinarians and team members to create a culture of well-being. And this is a great time if you are working remotely or have extra time to go through this. It's a really helpful program. eCounseling.com offers tele-behavioral health solutions to make access to mental health care more flexible, inexpensive, and time efficient. Great source for those of us needing additional support in mental health. Vets for Vets is a confidential support system provided by the VIN Foundation. Veterinarians needing emotional, psychological support can call. There's a phone number which I can provide to Stephanie for later, and also you can email at vetsforvets@vinfoundation.org. It's a great resource as well. VIN also has a Foundation Student Debt Center to help the students manage their debt load. And then the VHMA provides employers with a constructive approach to working with employees who experience personal or work-related concerns. So I encourage you, again, lean on your village, lean on support. This is a great time to make sure that you have these resources available for your team if they need it. And in the midst of every crisis, there is a silver lining. There is always opportunity. China seems to be improving. We have in South Korea too. So we have ways to look across the ocean and see signs of hope. This is a time also for you to start doing more fear-free if you haven't before. Make a treat menu within your hospital. This is a great tool. We have one in the toolbox already that's from our hospital, but if you want to make your own that's creative and allows clients to choose different food rewards that their pets enjoy. Spotify lists are easy and fun to make for clients. Music that they can play at home, as well as in the car for travel. This is a very valued and free service you can provide for clients. Social media tips for Facebook and Instagram. Never has it been more important to communicate, as I mentioned, to your clients and giving them up-to-date feedback on ways to enrich their pets at home, different ways to promote puzzle feeders, things to talk about with cat carriers. This is a great time to do that. If you haven't looked into cooperative veterinary care training with Monique Fairchild, awesome program to teach you how to work with our patients to lessen human interaction needed for diagnostics and treatment. If you haven't thought about telemedicine, you're probably the last one, because I feel like we're all being bombarded with how to implement this technology. So certainly see how that works for your practice. As I mentioned, indoor enrichment guidelines, Fear-Free Happy Homes is an excellent resource for you to steer your clients in regards to that type of enrichment, and also, of course, other fear-free educational pieces. And then lots and lots of different modules and webinars on Fear-Free's website for you to manage not only the logistics of Fear-Free, but how to really lead your team and to make sure that we all get through this together. So I welcome any questions, certainly hope that was helpful. My email was on the front of this. It's drnataliemarks@gmail.com. Certainly welcome any communication directly as well. Stephanie?
Yeah, thank you so much, Dr. Marks. I'll go over the questions that we currently have. We only have one right now. So just as a refresher for everybody, the Q&A section is at the bottom. So if you do have a question, go ahead and type it in there. I have one question from Kay Kemen. Since we're now making our own cloth masks, is there a color that is preferable for patients or for clients? I think this is actually a good question for PPE in general. So,
well, we know pastels are typically the least triggering for our pets. I will tell you the history behind my mask is we have donated most of ours and it's been diverted to human health. And so one of our clients actually reached out to us and knew that we were in need and made them out of the comfort of her home on emergency for us, which is really nice. So I have this basically soft pink and soft blue side for when I'm seeing patients. And then I have my flamingos for when I'm out in public at the grocery store. So yes, I mean, and there's certainly similar to the fear-free guidelines that are on the fear-free website in regards to colors, and Animal Arts has been wonderful in providing that when you're looking at remodeling and certainly adding that in. But the pastels would be ideal. I certainly think, again, at this point, wear a mask and take care of yourself. That's first and foremost. If your only mask is bright red, obviously not in a perfect world, it's not the best color, but at this point, take care of yourself first.
Yeah, thank you. And from Alexis Carmen, how are you going about calling clients about overdue reminders?
Well, to be honest right now, our checklist is that is a little bit lower on our list because right now we're just trying to handle our day. So when we have care coordinators, our CSRs that have extra time, our lists are generated every week of those overdue reminders. So when they can get to them, they do. But right now we have emergency after emergency after emergency coming in. And again, because we have divided into teams, we are trying to take care of the patients that are critically in need right now. So overdue reminders are getting called. I can't say that they're in the efficiency that we normally would do, but again, sort of in the spirit of this webinar, we have to do the best that we can with the amount of people that we have working. And for me, the triage of emergent pets right now takes precedent. And so when we can call them, we are, and certainly our clients, as I'm sure a lot of other practices are through an app and have the ability to look that up themselves. And we certainly encourage clients to do that.
Absolutely. And for one of the questions, I will get the list of resources and links from Dr. Marks and send that to everybody. So just so that question is answered. I know you also went over it, Dr. Marks, but we have a question about the recently reported tigers that have tested positive for COVID-19. Mm-hmm. So wondering about how real that is and just, yeah, if you want to go ahead.
Sure. So, so what I know is based on talking to Jason Stull, leading epidemiologist that I've interviewed several times, as well as talking to our state veterinarian here in Illinois and also a couple people through AVMA. What we know is that there was an asymptomatic zookeeper at the Bronx Zoo, and there were several of the big cats showing respiratory signs. And so they did test this tiger. It did come back positive. What we don't know, one is obviously where that tiger came in contact. Obviously the thoughts are, was this asymptomatic zookeeper obviously feeding the tiger and therefore the food bowls or the food a fomite? We don't know that. The tiger apparently is doing well. So we don't know if there will be any potential transmission back to any keepers. We don't know. What the AVMA is still saying is that if you have a COVID positive client, they should be socially distancing from their pet proactively, just in case. There is no confirmed recommendation from World Health, CDC, or AVMA right now that suggests that cats are going to directly receive and be infected with COVID-19 from us, and conversely, that they will be infectious back to humans. We don't have any of that information. IDEXX has tested quite a few dogs and cats within the US. None of them have been positive, but we do have a positive cat in Belgium, a positive cat in France, and 2 positive dogs in Hong Kong. So, and now this tiger. The reason that we are following cats so closely is because of the SARS epidemic and how closely cats played a role in that. And so it's not surprising to many of our experts in the field that there are positives within the feline population, whether there are large cats or domestic cats. But we don't, as of now, know if this is, again, a case of a cat, large cat, being infected versus infectious, or both. There is a big difference. And so as more information comes out, obviously, again, our leading sources will be providing that. I will be putting on more webinars later in the week, going over more information. There's a lot of great resources out there. I think, again, in the spirit of this webinar, if you have clients asking, you give them what we know to be true right now. You explain that's what we know right now, and that our governing body is still saying if you are COVID positive, socially distance from your pet. But right now, we do not have any definitive information that cats directly get infected from humans and vice versa. So I hope that helps in a way. I wish I had more information, but we are all sort of in the same boat, because this information, just like when we had dog flu in the States, this information is changing hour to hour, day to day. So we will continue to try and bring the most up-to-date information.
Thank you. And we are going to go a little bit over. Is that okay with you, Dr.
Totally
Marks?
fine, of course.
Okay, I would say we have a few more questions.
Sure.
So I'm a fear-free doctor and leader of the Fear-Free Initiative at my hospital, but I am not the leader in terms of management. So I worry that my management is not being proactive enough about this, and all I can do is offer suggestions. Do you have any advice how a middle tier leader can continue to lead when management is not leading?
Yeah, I empathize with you. You are not alone. I get that question a lot from veterinary technicians that feel very stifled in their ability to lead this initiative within hospitals where perhaps the management is either not supportive or is sort of complacent. So I would suggest 2 things. One is, I think it's always important when you are presenting something to a manager to have your thoughts laid out in a very concise and effective way of why it's important to the hospital and why it's important to your team. And so writing those out into a letter, a Word document, I'm happy to help you with that if you want me to proof it for you and give you some guidelines. But I think that's very helpful than just a casual conversation with them, is, you know, why this helps the work culture, especially right now, why our patients need that more than ever, why we need to be communicating to our clients about enrichment. You know, behaviorists right now are so concerned that after this pandemic, we're going to have massive amounts of separation anxiety in our dogs and cats, right? Because we're home with them nonstop. So I think there's a lot of reasons that fear-free practice is so essential still. And I would frame that still in the vein that safety of your team is number 1. So fear-free does really work with that quite a bit, because we are doing a lot of hands-off and very small team work when you're working fear-free. You, again, confining them to one exam room, reducing the amount of dog bites so that you're not dog and cat bites, right? Because you can decrease workman comp claims so that we don't have more team members out. I mean, there's a lot of different avenues that you could work down, but I think putting that concisely in, and also trying to if they're still not willing to work with you, trying to celebrate your own personal successes and the successes of the people in the team around you, because we really lead by example. And the more that you can generate that momentum around you, hopefully the more that the hospital understands the value of that work culture that you've created yourself as a fear-free leader. So again, if you want to reach out to me personally, I'm happy to help compose that in a very respectful way, so that your management team can perhaps see the value in what you're trying to do a little more.
Awesome, thank you. And do you have any ideas for supporting your staff when you as the owner are working from home? So not actually being able to see the staff, but wanting to support and be a part of that.
Right. So one, leverage your team, leverage your other managers, supervisors, so that they can be messengers of your message. I think this is a great opportunity if you're working from home to do remote check-ins. So send out an email to your team and say, I'm going to be checking in with each of you individually on email. Please be looking out for that. You know, I want to know how I can support you better, what needs you have right now. So that one-on-one, even though it's remotely. I think finding ways to support your team in what they need. So do they need stress relief at the hospital, right? Do they need stress balls and coloring books and any type of, you know, aromatherapy, whatever they need to take breaks? Can you be creative with their work hours, right? So that they can maybe have, if they have childcare concerns, can you reach out to them and see about doing some flexibility in the staffing so that the parents that are really struggling right now can maybe have a little less guilt if that's possible. But I think if you're working remotely, the more you can check in personally with your team members, and again, leverage your managers, make sure they're communicating the same message and reporting back to you as often as possible what their needs are. Hopefully you'll be seen as supportive from afar.
Awesome, thank you. Do you see Fear-Free, the investment that you made in time and effort, now paying off as pets are there without their people?
300 million%. Yes. We every day see the benefits of Fear-Free here, not just in our patients that understand how they're going to be handled here, clients that understand the value of PVPs, clients that understand the value of enrichment at home and traveling and different support accessories like pheromones and thunder shirts and all kinds of devices that we support to make sure that they are as calm at home as they are here. Clients understanding that it is a very different experience here than a non-Fear-Free hospital. We have had, I can't even tell you how many new clients a day during the COVID-19 pandemic. It's kind of crazy. But you know, people right now are out fostering and adopting pets and realizing that without friends and family to snuggle, we have pets to snuggle. And a lot of people need that. The human-animal bond we can't describe, right? It's different for everyone. And so why not start them off on the best foot and understanding what Fear-Free is and how it can create a really invaluable and strong human-animal bond at home. So yes, there will never be a moment in my life or career that I have any regrets about what we did to become a Fear-Free certified hospital, not just for our patients and clients, but also for our team members. It's a much better way to practice, and you feel good about doing the right thing.
Yeah, oh, absolutely. And this is an interesting one because, and I don't know if you'll even know the answer either, because I have not really gotten too much of this yet, but what as a pet sitter can I do to assist with clients whose pets are missing their visits, and basically all pet sitters are in lockdown and no longer conducive to making visits to these homes. So do you have any recommendations from a pet sitter perspective?
Yeah, that is a great question. And that's very tough right now. And I empathize with all the pet sitters and dog walkers and other types of pet care remote businesses right now. What I would say is that just like within our practice where we're having to be creative, I think pet sitters need to consider being creative as well and understanding types of enrichment that they can teach their clients at home. So if they were scheduled to have a lunchtime, let's say a dog walker that was supposed to come at lunch, maybe that dog walker or that pet sitting business can provide a one-on-one FaceTime or Zoom or something with that client and give them 3 suggestions of different things they can enrich their dog with at home that day. So maybe it's a licky mat, maybe it's ordering a puzzle feeder, maybe it's a hide and seek game with treats, maybe it's massage, maybe it's adding in a pheromone, maybe it's teaching them a new trick. whatever it is that they're comfortable, it gives them still that contact with the pet sitter. It definitely shows the value that that pet sitter provides and shows the connection that that pet sitter wants to stay with that family. But it gives them obviously that remote safety of not being in the home. Now, I will say there are people like us working in essential businesses that still need that support. So if there are pet sitters and dog walkers going into homes right now and doing that, that needed service for dogs and cats, please, 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 at bare minimum, be wearing a mask and gloves going into that home, making sure that that client understands the risk of you going in. Again, we have 20 to 50% of us are asymptomatic carriers, and until we can test everyone, we don't know. So you really want to make sure that that client understands the risk, especially if anyone in that home is immunocompromised. And when you go back to your own home, I would be changing clothes, taking off your mask and gloves, obviously using good hygiene, social distancing, all the things that we stress within our hospital itself. But I would really encourage pet sitters and dog walkers, as I said, to consider remote communication, sort of a teletalk within their own community, and creating different types of enrichment, or even creating chat rooms amongst other clients, maybe within the same apartment complex, that can share different tricks and games and ideas for keeping their dogs and cats enriched within that day. I think that providing a sense of community right now is what people need and are looking for.
Yeah. So I'm going to do one more question and then we'll conclude all of this. So thank you for staying on a little bit extra.
Sure.
We've had owners ask to have their pets wiped down after we do an exam. Do you do that, and what would you use?
Yeah, so we don't, because we're wearing gloves during the exam. And to be honest, again, we're wearing masks and gloves. So the concern for everyone wearing masks obviously came out of, Dr. Fauci's recommendations, in that now the National Academy of Sciences says that not only can COVID be spread from sneezing and coughing, but also from talking and just potentially, they say possibly, breathing, right? So I think some pet owners are concerned, could we, as we work with their pets, as we talk and touch, could we be transmitting COVID-19 onto their fur? And so what we tell our clients, if they have concerns, which I have not had that yet, but I'm sure it will come, is that we're using Virox products. We have been for many years now. Accelerated hydrogen peroxide cleaner, fear-free recommended. And this cleaner is what they're using in human health hospitals, right? So it's killing everything with contact time. So our entire room is cleaned down with Virox in between pets. We're using masks and we're using gloves. So we're not transmitting anything through the air, and obviously anything that we've touched is a brand new glove, right? So the risk of our pets having contact with anything positive is incredibly low. I would say if you really wanted to, you could wipe down pets with a baby wipe before they leave the practice. I don't see that as a big concern. And in fact, I've talked to Dr. Jason Stoll about this. Do we have to worry about a pet coming into our hospital, more for us, right, from a COVID-19 possible household? What is the risk of touching that dog or cat's hair or fur and actually transmitting to us? And his discussion with me was, you have much more of a risk of being a transfer human to human than you ever will from dog or cat to human, as what we know today. Because when the virus lands on that fur or hair is very porous, actually, compared to the other substances that we know COVID likes to live on, like steel and cardboard. And if it lives there, what they tell us is that it only lives potentially a maximum of 1 to 2 hours at most. And it's very difficult to transfer that virus then to us, and obviously vice versa. So there is incredibly minimal risk if you are cleaning with Virox, if you are using mask and gloves at all times to touch that patient. And then even if you wanted to baby wipe them before they leave, I see no harm in that. Telling the client that there is very, very minimal risk of that pet having access to COVID-19, again, as of what we know today.
Thank you, Dr. Marks. I want to thank everyone for attending today. Please know that you are not alone in this. We are all still trying to stand upright in a world that has literally been turned upside down. So if you have any questions relating to this series of webinars or about fear-free certification, please email us at wags@fearfreepets.com. I will also type that email in the chat section. I've typed Dr. Natalie Marks' email in the chat section. So make sure you stay safe, stay healthy, and do your best to keep on practicing. You guys are essential.
Thank you to everybody who joined. I can't echo Stephanie's sentiments enough. I just want to stress, this is hard for everyone, even the people that seem to be smiling and trying to put this all together. It is a challenge every step of the way, every minute of the day. So be easy on yourself. Do not judge. Don't be critical. Give yourself a break. My kids are not being homeschooled the way I intentionally wanted them to be. I just have had to let it go. We will get through this, but I really encourage everybody out there to rely on your village, manage yourself, and remember, first and foremost, it's the safety and health of your team. Happy to help in any way I can, and hopefully we will talk again under brighter circumstances.